Hi, I'm Stephanie Shelton, and this is Conversations on Health, How We Get There. Now, for the last 2 episodes, we've been talking about mental health, and now we're going to tackle another difficult issue that many families are grappling with: how and when to find a affordable and caring assisted living facility when mom or dad can no longer live on their own.
The outcome has been very good, much better than we had anticipated. She moved from an independent living facility into an assisted living facility about 2 or 3 weeks ago. We thought it might take 2 months for her to get acclimated and be happy, but she has been really very happy right out of the gate, probably in the first few days.
That's Rich. He lives in North Carolina, and I'm not identifying any further just to maintain privacy for himself and his family. Now, I wanted to start with the happy ending, and remember, his mom is 92, because the process of finding a place for mom, to quote the organization we're all familiar with, is so emotionally difficult, time-consuming, and often financially daunting. I asked Rich why he thought his mom's initial time has gone so well in the new facility, and how he and his family actually prepared her for the move.
The preparation was really to try to get her to recognize that she needed some help, and it was more than we could provide by stopping by periodically through. She needed to be reminded of what time of day it was, what day of the week it was, help getting to meals, making sure that if she fell, that someone would be checking on her regularly. So I think she got the message on that. And then the other thing, honestly, was that the cost of the independent living facility continued to go up, and it was putting a strain on us financially. We were able to access her long-term care policy in this new setting, the assisted living facility. Those policies don't apply to independent living facilities.
Okay, so let's re-rack it all to the beginning. Your mother was living in New Jersey, and you as a family determined that that wasn't going to work any longer. How did you get from there to here?
Just to clarify, so I have 4 sisters, no brothers. 3 are in North Carolina. 1 is still in New Jersey. 2 of the 3 sisters in North Carolina are nearby, so we're all close to where mom is currently living. She had been living with my sister in New Jersey. That situation changed for my sister, so we needed to have her move somewhere, and so there was consideration given to an apartment or an independent living facility in New Jersey, but we thought it would be better to have her down in North Carolina where there were more family members. At the time, remember, it was 4 years ago. So
Wow.
at the time, we didn't feel that she needed assisted living support. We knew it wasn't necessarily going to be too far down the road, but we were trying to figure out what was the best setting for her. So initially, she came down and lived with my wife and me, but we quickly realized that she needed more social interaction and intellectual stimulation that we could provide because we were out working all day long. So we found an independent living facility nearby, and
Uh,
that worked for 3 or more years.
3 years. That's a
Yeah,
good amount of time when someone is aging.
it is.
And then what happened? I mean, and again, when we were talking before the interview, you said that even though there was a large family, by most of our standards, most of us, maybe if we're lucky, we have 1 or 2 siblings. It just didn't work out that she could live with any of you.
True. So my wife was probably the first one to say, let's test out having her live with one of us. And I credit my wife very much for that. That, remember, was kind of more of a mother-in-law, daughter-in-law situation. So it didn't work great. I think it was just, I think if it were to work at all, I think it would have been better with one of my sisters, but they just weren't able to have my mom live with them for various reasons. So that part of the story. The other was that we thought, we're all gone all the time. We don't want mom just sitting around all day. So we felt like it would be very important to have her in some sort of facility where she could interact regularly with people. And and just so that her quality of life was higher. But also, even when we moved her down, she was beginning to show some signs of dementia, and we wanted to slow down the pace of decline. So we thought, yeah, if she's talking to people all day long, doing activities, that might slow it down. So it was a combination of reasons that we moved her there. And we had some residual funds that would be able to carry her down the road for a few years, and we all contributed.
She did not have her own money to take care of her.
No, not much. She struggled financially for a long time. My parents separated and divorced when I was in college, so younger sisters were still in high school. Youngest one, it wasn't even in high school. I have an older sister that was just getting out of college. So she really has struggled financially since that point in time. So there wasn't a lot of money available to use for her living expenses. So we knew that was going to be a challenge. But we selected a place that was a nice place, reasonably priced, and we knew that we could use some of her money and then supplement that with contributions from the siblings that could afford to do so, at least for a period of time. But really what happened was that as the money was declining to a very low level, my mom's dementia was also increasing. So it was kind of a combination of reasons that led us to seeking out the assisted living facility. And fortunately, she took out a long-term care policy long ago that covers most of her rent or her fees
Did
in
you
the
know
assisted
in the
living facility.
beginning that she had this policy? When you first started looking, I mean, I looked up the range of prices of assisted living, and it ranges from something like $87,000 a year in New Hampshire down to $33,000 in some of the southern states, the really southern states. It's a daunting amount of money, and that's not even for top level care or anything. That's just basic cost.
Very good point. I can give you some rough numbers that reflect what the here in North Carolina. I'm far from an expert, but just for point of comparison. So her living expenses they started out at the independent living facility at about $2,700 a month. So that was for her small apartment, a couple of meals a day. So, not a ridiculously high.
Yeah.
By the way, I think more in terms of monthly allocation, not annual amount of outlay. Then, as we started to look into the longer term situation, I did have some paperwork from her files when she first came down here that I had actually misread. It was a little bit confusing. So we thought that her long-term care policy was only going to cover about $1,800 a month for a 2-year period. And that kind of frustrated me. I said, why did mom even get this policy? That's not going to help at all, because most of the long-term care facilities, so assisted living would run in North Carolina, probably, at least in the Triangle area, 5,000 to 7,000 a month. That price increases a bit if they need memory care. And then down the road, if there's some serious physical ailment and they need a skilled nursing facility, then it's 12 to 14,000 a month. So that's a very daunting amount.
Yeah.
So we were looking at a lot of different options, including trying to access um, su support for her via Medicaid, which, you know, we weren't happy about, but that was maybe going to be the only way that we could provide the right amount of care for her. So as we started to look into those options and determine what would be required for her to qualify, I made some calls to MetLife, which is where she has her long-term care policy, to get a little bit more detail on that policy. And I learned that whatever we had seen 4 years ago when she first moved down was not her actual long-term care policy. So the policy that she got, which I think is she got it about 20 years ago,
Yeah.
to the best of my knowledge, covers about $5,800 a month for a period of about 4.5 years. That is a significant difference compared to what I thought was the case, $1,800 a month for 2 years.
Right.
So that changed the landscape for us. You know, when I found that, I told all my sister, I said, we can actually find something that's nice for mom and be able to, at least, you know, especially at the beginning. And then if that price increases because they raise their prices or she needs memory care, you know, the amount of shortfall will not be that great.
And
So
you all discussed this among yourselves, you know, as you were going along. Who did all the research?
I did most of the research. I mean, I had my mom's paperwork, and I sort of led the way on the financial side of things, but we talked a lot about it, and fortunately we get along really well. I think we came together incredibly well to find a place for our mom.
Let me back up for a second and
Yeah.
ask you about the emotional strain on a family to even have to do this. How did you guys, because I'm sure it was upsetting.
Yeah, it was very stressful and exhausting. Knowing that we couldn't afford, well, could not afford care for her was stressful. And so we had to go around and round on, all right, what are the next steps? Should we move her in with one of us? Should we move her in with one of us and then rotate around every 3 to 6 months? Should we go down the path of Medicaid, which is a helpful governmental program, but you hear stories that sometimes those facilities are not that good. So we were concerned about it, but we just,
Did you ever go to the point of looking at the financial requirements for Medicaid?
I did actually. So I talked with an attorney about a year and a half ago, just in anticipation of this day coming. And I think the qualification would have been met pretty easily for my mom because she didn't have very significant assets. So as I understand it, you have to have less than $2,000 of total assets. And my mom didn't have a house. She didn't have any pension. All she really has is Social Security. So it's the assets and then the amount of money coming in per month. And so based on what I was told by the attorney who specialized in this sort of thing, it looked like it would be fairly easy to get her qualified. And then, as we continued down or started down that path and I began to check about the long-term care policy, then, we made this discovery. Actually, what happened was we were going to try to use the long-term care policy for an facility temporary care situation. So a third party coming in, 3 or 4 days a week for several hours in my mom's previous facility, independent living. And so as we started to look into it, again, mind you, I was thinking, okay, it's $1,800 a month for 2 years. We should probably access it because we're not going to be able to use it if she has to go into one of these expensive assisted living facilities. So let's make sure we sort of get our money's worth. And she wasn't open to that. She just didn't want any help in her apartment. And then, as I was looking into it in more detail, found that one other thing, the long-term care policy does not cover in-home care. And my mom's situation in an apartment at an independent living facility is equivalent to in-home care. So
And
I
by
had to
in-home care, you mean somebody helping with like groceries and
meaning, if she were in her house, or honestly, if she were in one of our homes, that's in-home care.
right.
And this long-term care policy does not apply to that situation.
It
It's
only
kind of
applies
bizarre.
to some sort of generalized home.
Accredited facility for assisted living and memory care,
Interesting.
and skilled
Interesting.
nursing. So as we were researching, I said, we can't even use this policy for that situation. My mom was resisting, so the conversations continued and evolved a bit. We had more conversation with mom, and honestly, because my mom wasn't completely accepting her level of dementia, the way we led with the rationale was, we said, this place is too expensive.
As long as she was in that independent place, her own place, the facility itself did not provide anything else.
Right. You mean the services, right?
Yeah.
Yeah, correct. So an independent living facility is kind of like a retirement community, although, they vary. So it was basically that they have a central sort of dormitory building,
Right.
where there are lots of apartments. That's where the dining hall is. So she could go over there twice a day for meals that she took in her apartment. They called them cottages. They were small apartments across the driveway from the main building, but that was it. So they just provide that. They provide activities that you can partake of if you want, but they're not going to check on you to make sure you're getting over there, that what time it is, so you're taking meals at the appropriate time. You're totally on your own.
Yeah.
And that wasn't so bad when my mom first moved in, because her intellectual level was better. But as time wore on, she was just getting very forgetful, very confused about what day it was, what time it was. And unfortunately, she kind of became a hermit in her apartment. She wasn't going over to the main building. So all of the things that we had wanted when we first moved in there, the social interaction and kind of some level of intellectual stimulation, were gone. She just wasn't going over to any activity. But that wasn't their job.
Right.
They have a facility, they provide activities, they provide meals, but you're basically on your own.
So how much time, I mean, you and I trying to even text together and make a phone call has been difficult because you travel so much for work. How much time do you figure that as a family you put into this search for the right place for the amount of money you had?
Well, we started at the beginning of the year, and
This year.
this calendar, by late last calendar year, November, December 2022, we were convinced that our mom needed to either to have an outside care agency coming in regularly, or we needed to move her into an assisted living facility. And then once the policy details became evident, then we said, okay, we got to find something. So, I mean, I kind of led the way, but then we all assisted with the research. So I looked in the area, narrowed it down to about 6 or 8 facilities. I actually did call the organization A Place for Mom, so they kind of helped. They showed us different facilities in the area, and they even arranged some meetings for us. And so I went to some with one or both of my sisters. My two sisters went to several of them, and we kind of had our own little simple scoring sheet, and then kind of narrowed it down from 8 to 2 or 3, and then we just really zeroed in on, all right, of these 3, which ones do we think, or one do we think makes the most sense? So obviously
And
cost was a
you
factor,
didn't go
but
to
actually proximity was maybe at the top of the list, because we wanted to be able to get over to visit her regularly. So if she's close to 30 minutes away, that's more of a challenge versus if she's 10 minutes away, give or take. It took us, honestly, a good, I would say, 3 months to evaluate, to visits, to go to those visits, collect their information on the cost, and also where they thought she would most likely be appropriately be placed. In other words, in the assisted living neighborhood or the memory care neighborhood. Those are 2 different areas. Obviously, the memory care neighborhood requiring more attention by the individuals who work at the facility, and those neighborhoods, as they call them, are a little more expensive as a result compared to the assisted living. So my mom was probably close to the borderline, but she's not ready for memory care yet, even though she has dementia. I think the units are for the residents who have significant dementia. So anyway, so we wound up with assisted living neighborhood in a facility that's only 10 minutes away.
We, when my stepmother had to sell her house, and her 3 sons had to mostly make that decision about now what, and everybody in my family is scattered all over the country. The one brother who lived in her state, he and his wife took her in for a short time, but it absolutely didn't work out. They looked around and found a place that was really close to that brother's house. And it was the same kind of thing. She started out in her own place, basically in the building, and then progressed to the memory care. And it was, as places go, it was as good as they could get.
In our case, the facility that we selected was one where good friends of my wife and me had her mom there for a year, maybe 5 or 6 years ago, and she spoke very highly of it. So we kind of had direct input that, yeah, this is a pretty good place. And then I have a good friend, coworker, whose wife's grandma is at the same place. She's actually in the more intense care area, the memory care unit. But he told me that the family has been very happy with the way she's treated, and so I had 2 pieces of information that said this place is a good
very
spot.
Very helpful. So how did you sell it to your mom finally? Did you bring her over before you actually decided on it first to look at it?
We did. We probably brought her over there 3 or 4 times. And because of her dementia, I think a few times she didn't even remember that she had been there already, but that's fine. So we told her, we kept repeating the theme that we needed to have her go somewhere else because we needed a place that was more affordable. Her previous place had gotten too expensive, and that we wanted to make sure she was properly taken care of. And we tried to lead with the more significant thing. Hey, Mom, what if you fell, at this previous place? No one might even notice for a day. And like, if we didn't get over there, we wouldn't notice. And we were also able to leverage a situation that happened late last year where she was having some chest pains, and they rushed her to the emergency room at Duke University Hospital and never reached out to any of us. So
Mm.
we didn't know where she was. So, we were panicking for a while.
Yeah, sure.
Yeah, they probably didn't follow their own protocol on that one, but we said, we want to know that you're being looked after and cared for. And so she got it. So she did like the place, although, like anyone, a little bit resistant to change at that age. And so she kind of molded over for a while. We probably showed it to her, took her over there 4 times in a 2 or 3 week period. So she had a chance to process all of that. At times she said, I think I want to go back up to New Jersey. And we did have our sister, who still lives there, look at some of the options up there, just so we could tell mom, yeah, we looked at it, but they're even more expensive in New Jersey than in North Carolina. And let's remember, we want to be able to visit you regularly. There are more family members down in North Carolina. So we kept kind of repeating that message to her, and she finally accepted the fact that she needed to move. She seemed a little bit worried initially, and that's why we all thought, okay, this might take 2 months before she gets acclimated, but thankfully she got into it right away. So I mean, it's not perfect, but she's happy. She has things to do. They're looking after her. This place is even a little bit closer than the other place, the independent living facility. So I think we're getting over there a little bit more regularly. So it's really worked out well in the end.
Well, that's extremely encouraging, and I hope it continues to
I thank you. I
work
appreciate that.
because, like I said, it's stressful for the person going in, but it's probably more stressful for the family because you're the ones who've made that decision essentially for her. It's not usual that the mom or the dad makes that decision for themselves. Well, it's time
Right.
for me to go into assisted living. Goodbye,
Yeah.
and it's a little more difficult. So now that she's settled and it appears to be working and all of this is behind you, for someone just starting out on that rather unpleasant road, what kind of advice would you give them?
Well, I would say plan early and try to anticipate what might happen 2, 3 years down the road, so that you're able to figure out or evaluate the options and figure out what the best ones might be. That's just, general guidance, no matter what kind of financial resources you have.
Yeah.
It's important to see if your parent has some sort of long-term care policy, and call to figure out what the details are. It doesn't come jumping out at you off the page. And like I said, both my wife and I read a piece of paper that had us concluding that it was a much smaller amount for a shorter period of time. So we feel fortunate. I think, with respect to that, we might have just gotten lucky that my mom picked up a policy when they were first coming out, and the premiums weren't extremely high, and the coverage is actually pretty good. I don't think that's the case anymore, but still, it's worth checking into that. And then I would try to have the dialogue with the parent early on, so that they know what's coming and they don't feel surprised by the move, and they can actually participate in the decision a little bit, maybe even help identify which ones, or which one that prefer, if you have an option of 2 or 3. So that would be another piece of advice. We sort of did that, maybe not completely, because we had some restrictions, but anyway, those are the things that I would say would be useful.
All right. Well, it's a good place to stop, and I really appreciate your sharing the story with me and with all our viewers and listeners.
You are quite welcome. I wish you and them all the best.
Rich included a lot of useful information as we talked about how his family found a good and caring assisted living facility for his 92-year-old mom. Now, remember, his financial figures are specific to a relatively urban area of North Carolina. Costs vary state to state, of course, although the Medicaid limits apparently remain the same. It's a federal program primarily. Now, I'm including a number of useful links on the show notes to the podcast on my podcast page on my website. I plan to focus next on the healthcare crisis in the United Kingdom. I'm sure you've seen or heard or read about it. The huge financial and personnel issues of the government-funded and run National Health Service, or NHS as it's usually known. It's doctors and nurses, ambulance drivers, seemingly everyone constantly on strike for higher pay and more workers. Many Brits are complaining about long waits just to see their general practitioner, never mind complex surgery. The NHS began in 1948, and most UK citizens just love it. They want it to be fixed. What lessons can we learn from each other on this difficult issue? I schedule one new podcast episode a month. The drop day is usually the third Tuesday of the month. Updates wherever you get your podcasts. I'd really appreciate it if you would subscribe. I really would. We're on Apple, Google, Spotify, TuneIn, iHeart, Podchaser, and my host platform, the Podbeam app. The video version is on YouTube. Show notes and links on my website, www.stephanieshelton.com/conversations. I'm Stephanie Shelton, and until I see you again, please take care of yourself and all those you love. Conversations on Health, How We Get There is produced and edited by Frank Harold. Research assistance from Dr. Richard Saltman, Professor Emeritus of Health Policy and Management, Rollins School of Public Health at Emory University in Atlanta.